Kumba is considered the breadbasket in the southwest region of Cameroon. This has come with a cost. Underneath the bustling city lies health complications attributed to the economic activities, compounding to the impact of the current sociopolitical crisis in Cameroon's Anglophone regions.
Because of the situation we find ourselves in this part of the country, we've been receiving a lot of cases, I can call them casualties, that are coming from the crisis. The stroke attack here has increased because of the crisis, the gunshots that were everywhere, and all the stress on people losing their property, all the light, that put them into a lot of stress. And the next one that will follow after stroke is people with back pain, low back pain. Let me say spine, any problem with the spine, starting from the neck, from the head, right to the coccyx down there. That's another problem that people are facing here a lot, because we are in a region where many people are farmers. So stressing the spine too much will always lead to such things. So that's our second pathology that I can also say is about 30% that we are having here.
In this medical facility called the Presbyterian Rehabilitation Services, PCRS Kumba, between 18 to 20 persons come in for rehabilitation daily.
I have spinal cord compression. I've been here for 3 months something, but I've been on wheelchair for 2 months. So getting to a month now, I can use my leg, and I can say thanks to the therapists.
Here, when you come, the first thing you are being received. When you are received, you are sent to the cashier, where she is functioning like our own receptor at the hospital, receptionist. She will usher you in and give you a card. That card will permit you now to meet with the physiotherapist for assessment. The physiotherapist will do his own work now in evaluating you, knowing your problem, what is necessary to be done, and when it is done, if it is to end at the level of the physiotherapy, we will continue here. But if it is something that needs us to proceed to the physiotherapy department, to the orthopedic department, we will now make a requisition that we are telling the orthopedic department to produce us this gadget that is going to help this patient in this way, and the orthopedic department will also go on and to produce what the physiotherapy have requisited from them.
We are the orthopedic workshop. This is where hope is restored for those who have lost either limbs or want deformity correction. On ground to receive these patients is Maxime Messi, the lone female orthopedic technician, since the facility went operational in 1993.
At the start, it was very, very difficult because I never went to any school, so we did the internal training. Even now, we are still doing the internal training.
Initially trained as a laboratory technician, Messi found love in orthopedics, where she is happy serving humanity.
I feel delighted and very happy to serve humanity, because most people with disability, they think when they are disabled, they think in the society they are left behind, they are less privileged, but I want to make them to understand that despite the fact that they are disabled, they still have a vital role to play.
One of our youngest clients is a Coco Celestine, born with a leg deformity known as Genevagum, commonly called knock knees or K-leg. With the support of her supervisor and colleagues, Messi is steadily breathing life back to this child.
I've been here for about 2 months, 2 weeks. It started with POP to soften the bones, and now this is a caliper that we have handed over after 2 months, 2 weeks. I really feel good and happy, because it's not easy to see a child grow up with bent legs.
An orthopedic studies published in 2024 by Science Direct, between 2 and 7 children out of 10,000 births are born with limb congenital deformities. Here at PCRS Kumba, experts hope to lessen the burden that comes with disabilities through love and compassion.